Should you get Medicare Supplement Plan G or Medicare Supplement Plan N? Let's do a little case study. For the case study, we're going to use the example of a 68-year-old non-smoking male in the Chicago area who has a couples discount, a household discount. If he chooses Plan G, and this is just one carrier, all the different carriers could have different pricing, his premium would be $145.50 a month. If he chooses Plan N, his premium is going to be $102 a month. So if we do the math, we see it's about $43.50 difference per month. So why, and is it worth it paying more, or are you better off taking the lower premium? Let's look. This chart behind me, you've probably seen it in different publications. It's probably kind of confusing, and so we're going to use it and make it not confusing, okay? So first, if you look to the first column over here, you're seeing the different dollar gaps that if you did not have a supplement, you could end up paying if you had some sort of medical care. Then you're going to see Plan F, G, and N. Now, we're only focused on G and N because F is no longer offered to new Medicare beneficiaries, but just know that F, if you notice this column right here, it's all in yellow. Every single possible dollar gap on a Medicare approved claim is covered by F. Then if you look to G, which is right next to it, it's almost identical to F except for one benefit, and we can see that, the Part B deductible. And then if you go one column over to Plan N, you can see N and G are similar, but there's more yellow boxes, which means N has a little bit of a less dollar coverage. Before we get into the differences between the two plans, this is the most important concept I want you to carry with you as you think about, is G better or N for you? When it comes to Medicare, if you stick with original Medicare, your insurer is Medicare, not the Medicare supplement policy, not that carrier. So when you go to the doctor and a claim is submitted, let's say you have a $1,000 claim, it's submitted to Medicare. It is Medicare who is your insurer that decides, is it going to be approved or not, and if yes, how much? So once Medicare has gone through those steps, and let's say they approve it and Medicare has paid its portion, it's 80% on a Part B claim. The remaining $200, the remaining 20% is going to be sent to the supplement carrier, whether you're in Plan G or N. Remember, at that point, it's already approved. The supplement company has no discretion. They have to do what their boss Medicare tells them. But the question is, how much of that $200 do they owe? Now we'll take a look. So before we get into the specifics of this example, one thing I want you to notice is that both G and N do not cover the Part B deductible. That is the first $240 in 2024 for Part B claims that you, the Medicare beneficiary, must pay. You cannot cover it with a Medicare supplement policy. Once you've paid that $240, that is when Medicare's obligation kicks in to start paying for your claims. So that with both plans, it's identical, the first $240. So you've met that $240 deductible, and what happens? So we use the example of a $1,000 bill, and Medicare has paid $800, and $200 is sent to your plan G, and to your neighbor's Plan N, and it's the identical claim. So what happens? Under Plan G, they're gonna pay the full $200, the full 20%, because there are no other gaps except for the first $240. So the full $200 is paid. Under Plan N, the carrier has the same obligation with that 20%. However, it is minus a copay. If you see the box all the way at the top where it says Part B, coinsurance or copayment. So what it means is that the carrier has to pay the 20% minus whatever the copay is that you must pay. The max copay could be up to $20 for a doctor visit and up to $50 for an emergency room visit. So again, in this column, the supplement pays $200. In this column, let's say it was a doctor visit, the supplement's paying $180, you're paying $20 if they bill you for the copay, or if it was an emergency room visit, supplement is paying the $150 and you're paying $50. Those copays that I mentioned stay the same whether the bill is $200 or $1,000 or $10,000. You're never going to pay more than the possible $20 copay or the possible $50 copay for an emergency room visit. So the logic here is, do you pay more upfront or less upfront with the possibility of copays? Now, there is one other important benefit to know about, and it's something called Part B excess charges, and you're going to see that G covers it and does not. So what are we talking about here? In the world of Medicare, most doctors sign on the line with Medicare and they do something called accepting assignment. So that means that whatever the Medicare approved amount is, that's the most they're going to get paid. There's a small group of doctors out there that are contracted with Medicare, but they do not accept assignment. And they say that's 2% of the doctors. So 98% of them accept assignment. But so what happens with the doctors that don't accept assignment? Let me give you this example. Let's say you have a claim and it's $1,500. That's what the doctor normally charges, but Medicare approves it at $1,000. That $500 is gone. But now you have this $1,000 bill. And let's say you're seeing a doctor who does not accept assignments. So Medicare is going to pay the $800. Your supplement's going to pay the $200 we already discussed. But now this doctor can bill you 15% over the Medicare approved amount. So let's say that's $150. Under Plan G, if there are excess charges, G is going to cover it. Under Plan N, if there's excess charges, N is not going to cover it. It is your obligation to pay. So what do I tell my clients to do in that scenario? Remember, I said 98% accept assignment. And we hear that 2% may be made up of a lot of psychiatrists, although I don't have a list. But the best thing you can do is you can go on to medicare.gov, you can look up under providers, and you can see if your doctors accept the Medicare approved amount. That's going to help you make a decision when you're weighing G versus N. And then going forward, if you add new doctors, just make sure you're choosing doctors that accept assignment. Now, in explaining that, that is not me suggesting you should go to N or should go to G. It's just about weighing what one covers and what one doesn't versus the cost. And for each person, the answer is going to be a different answer. One important thing I want you to notice is that this discussion with the gaps and the differences between G and N is focused on Medicare Part B, everything outside of the hospital. One of the reasons I don't need to explain the differences on Part A, hospital coverage, is because G and N cover them identical, no gaps, and they do it actually exactly the same as Plan F. So what should you do? Every person, the answer is going to be different. I will tell you, I confidently put people in both plans. You're going to have the same procedures, claims covered. It's already been determined by Medicare. Again, as I said, it's just how much you contribute to the cost. For somebody that's going to the doctors 5 times a month and they're new to Medicare and they're able to get into a plan without health questions, maybe G is the way to start, because maybe the savings that you're going to have in premium is going to be outweighed by the costs in copays. So you look at all those different kind of factors when you're making the decision, and whichever you choose, it's going to be a good decision because it's going to give you great coverage. And one thing to know, sometimes people choose N so it could keep them into original Medicare. Maybe they're concerned about the cost of G and they want to know they can stay in original Medicare and handle the costs. So, which is better for you? They're both good options and something to weigh and think about.